Breast Cancer Awareness Month, we're asking the experts what you need to know about the disease. Joining me now are Dr. Jenn Carroll and Moolenaar of Southern Hills Hospital. So first we're asking people, well, how many people are at risk for breast cancer?
So essentially all women are at risk for breast cancer. About 240,000 women are diagnosed every year, but within all of our lifetimes we actually have a 1 in 8 chance of being diagnosed with breast cancer.
And men also are at risk, right?
Correct. Much less common obviously than women, but men do comprise 1% of the breast cancers that are diagnosed every year.
And so for people who may think that they are at risk, how do they know that? Is it genetics? What is causing it?
So ultimately the greatest risk factor is actually age. So our greatest risk just goes up by living long enough to get breast cancer. Obviously women that do have a family history are at an increased risk, especially if that family member was diagnosed before the age of 40. Those women can actually have over a 5 times increased risk. So if that's something that you know is significant with your family history, you should talk with your primary care provider about increased screening.
Right. And what are the signs and symptoms that people should look out for?
Obviously, any new lumps or bumps that you may notice would be a concern that you should talk with your doctor about. Also, anything like any drainage or redness of the skin that's different than what you may have noticed before.
Right. And I think people would be concerned, especially if they do not have insurance, but there are actually services out there for people who do not have coverage.
We do at Southern Hills this month, for the month of October, we're offering $75 mammo specials for those patients who either don't have insurance or maybe whose plan doesn't cover the screening mammography at this time. And that price includes the mammogram as well as the radiologist interpretation.
Yeah, is this the Pearl the Pink Fire Truck?
No, but a couple of times during this month, so October 9th and October 16th, we've invited Pearl the Pink Fire Engine from North Las Vegas to come down to Southern Hills just to raise awareness and provide some more education, but that will be parked on our campus on those days after 4 p.m. And it's just a neat experience. We'll be using that opportunity to not only raise awareness, but honor survivors.
Hey, so please convince people to get tested and how, tell them why is it so important rather to get yourself checked.
So I think the biggest thing is that mammograms increase our early detection of anything that could be of a concern. And in the result of that, we've now had improved mortality rates, improved outcomes for all of the patients. And so these women aren't just numbers. This is your wife, this is your mom, this is your sister. And so really encouraging all of us to start our annual screening at the age of 40 is the best thing to do.
All right, thank you so much for joining us. This is a really, really important topic.
It is, absolutely. Thank you so much.